Do you know paying attention to your hands can help you prevent heart disease? Research shows that your hands are one of the most overlooked organs that signal problems with your heart. Recent worldwide statistics show that over 30% of deaths are caused by heart disease. In fact, according to the Center for Disease Control and Prevention, someone suffers from a heart attack every 40 seconds in the United States. You would think that such a deadly disease has many warning signs, but it does not. A new survey by American researchers found that over 63% of people believe it's likely they will suffer from heart disease within the next 10 years. Even though everyone sees their hands all the time, most people don't notice when they are signaling a serious health problem, such as cardiovascular disease. In today's video, you'll learn 5 easily ignored signs and symptoms on your hands that could warn you of heart trouble. As always, this video is educational and does not constitute medical advice. We are not doctors. Number 5. Painful finger bumps. Lumps on the fingers, especially at the tip, that are tender, purple-pink, and painful are called Osler's nodes. These lumps could be a sign of infective endocarditis, a life-threatening inflammation of the cardiovascular system. A bacterial infection that spreads into your heart and blood vessels could lead to endocarditis. If you notice painful lumps on your fingers, you should not ignore them because doing so might cause irreversible damage to your heart. A report from Wayne State University School of Medicine explains that Osler's nodes develop as a result of inflammation in the blood vessel. This leads to bacterial infection in the dermis, the middle layer of the skin, which leads to increased inflammation in the cardiovascular system. Osler's nodes may disappear on their own within a couple of days, but this does not mean it's harmless. See a doctor for a skin biopsy if you suspect that the lumps on your fingers are Osler's nodes. You can also consult a cardiologist to determine if the bump is related to a heart condition. Number 4. Reddish-brown or purple lines on nails. Red or purple lines underneath your nails are a common symptom of splinter hemorrhages. This condition results from damaged blood vessels on your fingernails, and it could be a sign of heart-related issues. According to the American Academy of Dermatology Association, splinter hemorrhages, alongside fever and irregular heartbeat, could be signs of heart disease. Researchers from the Mount Sinai School of Medicine in New York explain that multiple lines on your nails could show a serious health problem. Splinter hemorrhaging occurs because of bleeding in the blood vessels underneath your nails. This could be caused by trauma or bacterial infection that has spread into the cardiovascular system, says the New England Journal of Medicine. Number 3. Fingernails clubbing. Even though you probably never heard of the term clubbing, an article published in the American Journal of Medicine says it's a common condition. People who have clubbing experience enlarged fingernails, soft nail beds, and downward curved nails. It usually occurs when oxygen in the blood is low. One of the major causes of clubbing is infective endocarditis, which is a bacterial infection of the heart chamber and valves. While this condition is common in people with birth defects, it can also occur because of heart disease, osteoarthritis, and lung disease. If clubbing is caused by heart disease, the symptoms will begin in the thumb and index fingers. This disease develops quickly, but can be healed easily once the underlying cause has been treated. If you notice your fingernails are bulging, see a physician as soon as possible. Number 2. Weak, tingling, and waxy hands. Amyloidosis is a rare condition that is characterized by numbness, pain, weakness, and wax-like bumps on the hands. It develops as a result of the buildup of an irregular protein called amyloid. When amyloid deposits increase in the heart, it replaces the heart muscles and causes cardiac amyloidosis or stiff heart syndrome. This condition makes it difficult for the heart to function properly, and it might lead to cardiovascular cell signaling problems and abnormal heartbeat. The American Heart Association Journal explains that cardiac amyloidosis reduces the amount of blood that flows into the heart. This leads to a slowdown of blood circulation in the body. Because the blood supply is low, the amount of oxygen your hands receive is reduced, thus causing wax-like hands, pain, and a weak grip. If you notice any of these symptoms on your hands, contact your physician without hesitation, as your heart might be in danger. Number 1. Colored spots on the palms. According to the Harvard Medical School, bluish-red or brown painless patches on the palms are called Janeway lesions. This condition is caused by blood clots containing bacteria that lead to infection in the circulatory system. Janeway lesions develop and disappear quickly, often within days, which means most people will not notice them. That is why you need to consult a doctor as soon as you see discoloration on your palms to test if you have a heart problem. A study published in Clinical Cardiology shows that 80% of heart-related problems can be prevented by avoiding harmful lifestyle choices. The team adds that a poor diet, being overweight, and cigarette smoking significantly increase a person's risk of cardiovascular disease. This means that you can reduce your risk of heart problems by modifying your lifestyle and paying attention to your body, especially your hands. Are you including heart-healthy foods in your diet? To get your free, heart-healthy, anti-inflammatory diet plan, click the link below. If you enjoyed this video, like, share, and subscribe, and click on the bell icon so you never miss a video. And now, over to you. What are you doing to support your heart health? Leave your comments below. We would love to hear from you. And be sure to check out this video.